Good afternoon, everyone, and thank you so much for joining. I'm Dr. Allison Arwady, Commissioner at the Chicago Department of Public Health. We're here to give a COVID update. I'm very pleased to be joined by Pedro Martinez, the CEO at Chicago Public Schools, and Dr. Geraldine Luna, Medical Director at the Chicago Department of Public Health. I'm going to run over some data. I'll then hand it to CEO Martinez, and then Dr. Luna will finish up with some additional Spanish remarks. So first of all, overall, we continue to make excellent progress against COVID in Chicago. Our cases are declining. We're currently averaging 355 cases per day, and you see that that compares to our worst, November 10 of 2020, approximately 10 times that high, 3,356 cases. So I put a red box around October because I want to highlight that it was last October that our big fall surge kicked off. So we are pleased with where we are right now, but watching very closely as the weather starts to get a little more like October and we start to move inside. We'll be watching really closely for potential increases. Similarly, our positivity continues to decline. We're currently at 2.2% across the city, which is great. That compares to about 16% in November and 30% in the very beginning of the first surge when there was not much testing availability. If we put our numbers in some context, you see that our case number remains in that substantial transmission or substantial risk category, but it is decreasing. And our test positivity, our non-ICU capacity, and our ICU capacity are all in that lower transmission, lower risk category. So very pleased with that. As you've seen me share each week, the biggest risk factor by far for being diagnosed with COVID, hospitalized, or dying from COVID in Chicago is not being vaccinated. And this continues to track week over week. The red line represents Chicagoans who are unvaccinated. The blue line represents Chicagoans who are fully vaccinated. And you can see those fully vaccinated would represent the breakthrough cases. We are seeing both decline, as we would expect, as we're seeing improvement across the city. The hospitalization in particular is where we start to worry because people who have not been vaccinated have more than a 10 times risk, have more than a 10 times the risk of being hospitalized compared to people who are fully vaccinated. And that only grows when we go to people who die from COVID here in Chicago. So if you look at this, we are still seeing death rates rise among those who are unvaccinated. We're averaging 4 to 5 deaths from COVID every day in Chicago. And typically that is what we call our lagging indicator. It'll be the last one that we'll see to improve. So a lot of those unvaccinated folks are people who may have been in the hospital for 2 and 3 and 4 weeks. And unfortunately, some of them are now passing. Remind you, Protect Chicago 77 is our goal for at least 77% of all eligible Chicagoans 12 and up to at least start their COVID vaccination series by the end of the year. At the end of last week, we were at 72.9%, so making good progress there. And I want to call out a few community areas that are doing particularly well. In addition to the zip codes, which you can find on our website, as always, we've also got this broken down by community area. So the darkest blue here represent community areas where more than 77% of eligible Chicagoans have gotten at least that first dose. And then as the colors get lighter, you see the percentage goes down. And then if we look at the percent of residents who are fully vaccinated, again, dark blue here represents Chicagoans who are fully vaccinated, at least 77% of them. So you see that's a much lower number, and really every community area continues to have a ways to go here. And every time somebody's getting vaccinated, we're doing 5,700 vaccinations on average across Chicago right now. Every single one of those is pushing us toward our Protect Chicago 77 goal, representative of our 77 community areas. I want to give a few quick shout outs to these neighborhoods that reached important milestones for Protect Chicago 77 this last week. Austin, Avalon Park, and Grand Boulevard reached that 60% threshold for first dose coverage. Humboldt Park reached 70%. Brighton Park, yay, reached 77% in first dose vaccination coverage. And then East Garfield Park had the biggest increase in first dose vaccine coverage. So thank you to everybody in those community areas who's getting vaccinated and all the people that continue to work so hard to make vaccine accessible. As a reminder, Pfizer boosters are available. If you received a Pfizer vaccine series, meaning a first dose and a second dose of Pfizer, and it has been more than 6 months since that second dose, you should receive a Pfizer booster if you are over the age of 65, if you're a long-term care facility resident, or if you're over age 50 and you have underlying medical conditions. So please, if you fall in that group, especially if you know anybody over 65 who got a Pfizer vaccine, please let them know they should get a booster. It remains free. It remains widely available. You can get it at a pharmacy. You can get it through the doctor's office. We'll be standing up in October with our flu clinic, some opportunities at the city colleges on weekends for people to get it as well. But we have seen the vaccines continue to work beautifully, but in people in that oldest age category or with underlying conditions, that's where we've seen some more breakthroughs, and that's where that recommendation comes from. People who are 18 to 49 with an underlying medical condition or over 18 but working in a high-risk employment setting also are eligible and may receive the booster. If they got Pfizer, you get a Pfizer booster. You can visit chicago.gov/flu to find out where you can get your flu and COVID vaccine. We are just starting to see our first few cases of flu here in Chicago. And as you see, this is the combo you don't want, flu and COVID. So we need people to get both vaccines. Everybody over the age of 6 months should get a flu vaccine every year, and they're widely available. And looking ahead, 3 dates I wanted to call out. October 14, the FDA's advisory committee is going to formally start considering the Moderna booster. So if you got your first 2 doses of Moderna, usually it takes about a week or so after the FDA starts looking at this. So probably around October 20-something, we'll have guidance for you about Moderna boosters. Similarly, October 15th, the FDA's advisory committee is going to begin considering the Johnson & Johnson booster. So if you got Johnson & Johnson the first time around, we'll have more guidance for you, also probably in that October 20-something range. And then really exciting, this is preliminary, but most likely October 26th, the FDA's advisory committee is going to begin considering Pfizer vaccine for 5 to 11-year-olds. And I know that's a date that a lot of people have been waiting for. As a reminder, that's just the first step. The FDA has to do its review, and then the CDC comes in and puts more details around it. But if all goes as we have historically seen in terms of timing, and as long as the data, of course, supports the safety and efficacy, I would expect that we may have a vaccine starting to be available for those younger children in early November. So let's talk a little bit more about children. Our highest COVID case rates in Chicago are still in people in their 30s, 30 to 39 years old. And we've had a stable number of child cases, 0 to 17-year-olds, since August 30, when most of our school systems went back to school. So you can see that graph is showing you those colors represent the different age groups. The blue is the 0 to 17-year-olds along the bottom, and that's from August 30 through to the present. We've not seen any big increase in those child cases, which is a very good sign that not just in CPS, but in our schools across this city, mitigation measures continue to work well in terms of having kids in school and protected from COVID. Few more child numbers. The high COVID testing rates in children continues. We're seeing more than twice as many kids be getting COVID testing now in September and early October as we were over the summer. And even in that setting, we've not seen a big increase in child COVID rates. So that's very reassuring. We continue to average fewer than 1 Chicago child under the age of 18 being hospitalized with COVID each day citywide. Obviously, we want that number to be 0. But in terms of the large number of people still being hospitalized, I just wanted to make sure folks were hearing that. Less than 1 child being hospitalized each day across the whole city with COVID. We've not seen any deaths in Chicago children from COVID since school has been back in session. Obviously, a death in a child is particularly tragic. We've seen 6 COVID deaths in children in the whole pandemic in Chicago. So 6 deaths in people aged 0 to 17 among approximately 6,000 COVID deaths that we've seen in Chicago overall through the full pandemic. And certainly, we know those families, we remember, those children and how hard that has been to see those children lost. But I do want to put those numbers in comparison. 6 COVID deaths in 19 months. And Chicago, on average, if we look over between 2008 and 2019, Chicago does average 415 children dying every year from all causes. And that's ranged from a little over 300 to a little over 500. So 6 is a relatively low number in terms of overall child deaths in Chicago. And all I can say is thank goodness that this has hit older people much, much, much harder than it has hit children. If we look, we're going to hear a little more about CPS. CPS.edu/COVID is your one-stop shop for all your questions, but also specifically for data. This is just a snapshot from the dashboard. I'm just showing you quickly where you can look for this, and we're going to put this in a little bit of perspective before I hand it to the CEO. So the case rate for COVID remains low in Chicago public schools. Since the start of the school year, we've had less than 0.5%, 0.48%, about 4 to 5 out of every 1,000 CPS staff and students having a positive COVID test and being present in a CPS facility when they could have been infectious, meaning starting 2 days before their symptoms. And in the last 2 weeks, that's been a total of about 0.19%, so 2 out of every 1,000 staff and students. And that is consistent with what we've seen across other school settings, not concerning, not increasing. Also, if you just look at this by the numbers here, this is showing you since, again, schools come back into session. Yellow represents reported cases in students. Blue represents reported cases in staff. You see this up and down pattern. The down pattern tends to be the weekends. I want to remind people that if your child is diagnosed with COVID, we want you contacting CPS right away, even if it's the weekend, because we start that case investigation and contact tracing. But what's good news here is we're not seeing those numbers increase significantly as we've moved from August to October, and in fact, they've been stable or even decreasing. Screening testing, we're going to hear a little bit more about from the CEO, but to put it in just some perspective and a reminder of what that is, the screening testing is for people without symptoms. So this is regular testing, and the main reason we do it is to see, are we missing unrecognized spread? It's not about testing every kid every week, every teacher every week. It's about making sure at a district-wide level, we're not missing cases of COVID. So last week, our screening test results were about 0.2% positive, 2 out of every 1,000 tests performed, and that's consistent with where we've been from the beginning. That is in line with expected positivity rates. It's actually lower than we've seen in many other school districts. We've not seen signs of unrecognized spread. And we will be working to ensure that this screening is where it's most needed, especially for unvaccinated people, that gets prioritized while obviously continuing to promote vaccination. You'll hear a little bit more about that. I also just wanted to give a quick update on clusters and outbreaks at CPS. So whenever there are multiple cases diagnosed at a school, right away the CPS team is looking into that. And it's one of the reasons we want to hear right away from you if your child has been diagnosed with COVID, or for a staff member if you have. And then we're working to see, is this potentially a linked case within a school, or is there some association outside of a school that's more likely? So if there are 2 cases in a school and they're in siblings, it is much more likely that that transmission was at home than it is at school. But if these are 2 cases and they don't have other out-of-school links and they are known to be close contacts, we would say that is more likely a potential in-school cluster or potentially an outbreak. So we use the term cluster when there have been 2 or more COVID cases potentially linked in a school setting. We count extracurricular activities there as well. The average size of the clusters to date in CPS schools have been 2.4 cases. And this is through last night. We've seen 12 cases across the whole district since school opened, with 2 potentially linked cases, 3 with 3 potentially linked cases, 2 clusters with 4 potentially linked cases, and 0 clusters or outbreaks with 5 or more potentially linked cases. The Illinois Department of Public Health does report out anytime we're seeing even 2 cases or more. Historically, in the prior school year, the IDPH was asking us to do 5 or more. So that's where we've gotten some questions questions about clusters and outbreaks, but this is what the numbers are. And if we look at this by numbers and an outbreak here, so this is highlighting on the right there, in gray are clusters that only involve students. We've had 9 2-student examples. We've had 2 3-student examples and 1 4-student example. In the middle, we've got a 2-person, 3-person, and 4-person cluster that were only in staff. And then on the left, we've had 2 that were a combination between adults and children. As you know, CPS also has on the website the number of individuals in quarantine isolation. It's been a lot of people in quarantine. And one of the things that we're continuing to really be looking at is, does everybody that has been being quarantined historically need to continue to be quarantined? Of course, we want to make sure we are keeping the school systems just as safe as they have been. And so I wanted to just update the numbers I shared last week, that very few students are testing positive after close contact at CPS schools. Most of those children are being quarantined, but if they're fully vaccinated, like in a high school, they might not be quarantined. We've continued to track forward any child known to be a close contact, and fewer than 2%, fewer than 2 of every 100 students who were close contacts of COVID cases at CPS in that first month of school subsequently tested positive for COVID. That's more than 15,500 students. 1.6% total tested positive. 98.4% did not test positive. You don't definitively say that these were or were not because of school, but it lets us know that there are a lot of children being quarantined right now and not subsequently testing positive. And I hope that helps reassure parents, because I know how worrisome it is to hear that your child has potentially had an exposure at school and needs to be quarantined. I wanted to end quickly on 3 questions that we are getting all the time and just run through them. Question: do I need to tell the school or school system if my child tests positive for COVID? The answer is yes, because it is true that all positive COVID tests for Chicago residents, any age, performed at any testing center, doctor's office, by law, it gets reported to the Chicago Department of Public Health. We do case investigation and contact tracing, but that can take some time. And the way to ensure the appropriate school-based investigation, no matter what school your child is in here in Chicago, is to report any positive test to the school as soon as you receive it. It's really important to help stop the potential spread, and the school, no matter what school you're at, will protect the child's privacy in the investigation and notification. At CPS, parents, guardians can report cases at cps.edu/COVID results or call the helpline if you have questions. Second question: does my elementary age child have to quarantine if someone in my household tests positive for COVID? The answer is yes. Anyone of any age who is unvaccinated in your household needs to quarantine if anyone in the household tests positive for COVID. Whether that's mom, whether that's little sister, whether that's grandma, anybody in the household, if there has been a case, anyone who is unvaccinated needs to quarantine. But vaccinated members of the household do not need to quarantine unless they develop symptoms. Last question. I was notified by my school that my son needs to quarantine because of potential close contact to a COVID case at school. Do my other children also have to quarantine? The answer is no. We do not quarantine the contacts of people who are quarantined. We quarantine the contacts of cases, people who test positive for COVID. And I know this can be confusing. So unless your quarantined son develops COVID symptoms or tests positive, your other children can continue to attend school regardless of their vaccination status. That has never changed. It's been true from the beginning of COVID. We don't quarantine the contacts of quarantined people. And remember, quarantine does not mean that child has been diagnosed with COVID. It means they've been exposed, and more than 98% of CPS students who were quarantined in the first month of school did not go on to develop COVID. And with that, I will be very pleased to hand it over to Pedro Martinez, the CPS CEO.
Thank you, Dr. Arwady. So first of all, again, for me, folks, when I see the data, it just tells me very clearly, with the science, with the data, our schools are safe. We're not seeing outbreaks. We're not seeing a ramp up in cases. Doesn't mean that we can't be better in our safety procedures, but the reality is that that's what the data is showing us. So one of the things that I want to announce, and this is really, as we looked at all the data, one of the things that we are starting to be concerned about is, and we're getting, so there's two sides to this, right? We get pressure on, you should be quarantining more children. We were worried the schools are not safe. We hear that. We also hear the other side, which is families saying, my child's been quarantined. What do I have to do to get my child back in school? One of the things that we know, if you look around the country, more and more districts are really looking at strategic ways to reduce quarantine in a very safe way. So one of the things that we did is we consulted Dr. Arwady, looking at the CDC guidance, looking at both Illinois and city Department of Health guidance. And one of the things that right now is very clear is that the health professionals are recommending that we go from 14 days from a quarantine period to down to 10 days. And that is coming across consistently. So we decided in the district that we will be putting this in place starting this Saturday. And the reason why it's this Saturday is we want to make sure that our principals, all of our staff, all have proper notice. We let parents know. And so effective, any case we identify starting October 9th, we will be letting parents know that the quarantine period will go from 14 to 10 days. Again, we're doing this because that's what the science is telling us to do now. So let me give you a couple of data points. So right now, you can see the number of tests we've administered, both for students and staff. We've actually now at our 502 schools. One of the questions I know you're going to have for me is this: every single school that we wanted to get in. We do know that we have a handful of schools, a little bit over 10, that for different reasons there was not actual testing going on at those schools. And so those are things, and I'll explain a little bit of just the challenge we're seeing on the ramp-up side. But that's the current data right now. So let me just show you the charts, and then I'll explain the differences in numbers. So this chart, which is, you can go right to our website, this shows you the trajectory week to week in terms of the number of COVID tests that are being administered every week. So what this number shows you, so again, going from 6,000 just 2 weeks ago to over 11,500 just this last week, those are tests, by the way, where we have the test results. So in other words, and because it takes at least 24 hours for us to get test results, that really for the sake of simplicity, really is testing through Thursday. When I go all the way through Friday, the actual tests are closer to 15,106 and up from 7,827. So what I want you to look at is the trajectory. So in other words, the ramp up is happening. We went up almost more than 7,000 more tests being given just from week to week. So that's important. Here's the challenge. What you're seeing now, both staff and students, is the number of consent forms that are being submitted. Now, when I consent to be tested, to be clear, I might consent today. It doesn't mean that I get a test today, right? So the way the process works is we have our vendor, our partner, they are deploying staff, scheduling ahead of time based on the demand at each school. And so I might get consent today, and the goal is hopefully that I can get tested next week. So that's just the logistics of it. The challenge that I'm seeing right now is, you can see we're already at 35,000 consents for testing. And so what I am now looking at now, and we're having very frank conversations with our partner, is what is that ramp-up period? Because you can see there's a gap right now. And so the good news is more people are consenting. The good news is we're ramping up the test, and I can see it clearly. But of course, the data tells me right away we have to really look at over the next several weeks, how quickly can we really ramp up? And I will tell you folks, the challenge is staff. It's literally staffing. And so we're working with our vendor to support them on finding the staff, but it really is staffing up. Staffing up, training, that's the biggest challenge. So, and we are, and of course, and because we're really, our goal is to get to every school, that creates another logistical challenge, right? Because you have so many staff, but they got to go from one building to another. And again, keep in mind, they need at least a week's, they need to schedule at least a week ahead of time because of the logistics of how many schools we're dealing with, and just to be able to properly plan. So I just want to call that out. Those are some challenges that I'm seeing right now that, again, it just begs me to go deeper, to go further. And really, for me, it starts with, what is the realistic ramp-up period for us to be able to meet the demand, knowing that that demand of consents is going to continue to go up. So that's where we're at right now on these data points. Oops. Oops, sorry. Let me just end with these two slides. Oops. Oh, the other thing is, so contact tracing. So we are seeing continued improvement in contact tracing. We are getting now 72% of our cases that were contact tracing closed within 24 hours. That is the gold standard. Our goal has always been to be within 48 hours. We're getting now close to 93% of the cases now that are being closed out within 48 hours. So again, we're not going to stop to 100%, but it's significant improvement from what it was even just a few weeks ago. Again, everybody, please, we need to make sure we always have complete, accurate data. Our staff always want to remind you, this is the way to report cases. You have our website, cps.edu/COVID results, and then our contact tracing will then begin the process of contact tracing once we know. And of course, and I know Dr. Arwady has said this, and I'll tell you, for me, as a parent of a soon-to-be 11-year-old and a 7-year-old, we have been, in my former role, I was pushing at the federal level around boldness around vaccines and getting more clarity on the timeline for 5 to 11-year-olds. And so knowing now that the advisory board is getting that data on the 26th, and if you look at previous history, it's always within a week or so that there's final recommendations. That gives me hope. That gives me hope for our families of our children 5 to 11. Vaccines are on the forefront. And for me, and we have an amazing resource with Dr. Arwady and the Department of Health here. So that is something that I will also ask for your help, that we need to work together to help our families, get our children, especially 5 to 11 years, once those vaccines are approved, so that we can help them get the access, get the information they need. I know this is going to be nonstop for us, because at the end of the day, folks, again, do I wish we had full COVID testing at every single school, which is what I have in my former district? Absolutely. That started back in November. I started that back in November 2020. I know what it takes to ramp up. So that's why I'm looking at this information very, very closely, because I know what to look for. And again, I'm going to have, by next week, we'll have more answers for you around how quickly that ramp up can be, because that's my biggest question right now. But I also know, even with COVID testing, even with very tight safety procedures like masking, like we have now in our schools, at the end of the day, the only way we're going to get through this pandemic is through vaccinations. That is it. That is it, folks. It is through vaccinations. And so again, I am cautiously optimistic now that we see potentially a timeline of 5 to 11-year-olds, that's an area we have to pivot. But again, we want to keep reminding you of our safety precautions, or again, of how do we keep everybody safe. And so please, again, and I believe now, I'll bring my colleague to come up.
Thank you. Muy buenas tardes a todos. Yo soy la doctora Geraldine Luna, directora médica del Departamento de Salud Pública de Chicago. Y hoy les voy a traer unas actualizaciones y voy a resumir también en español los señalamientos que se han hecho y las recomendaciones del Departamento de Salud Pública y del CPS, que es nuestro Departamento de Instrucción Pública. Las cosas siguen progresando aquí en Chicago. Estamos promediando 355 casos de COVID-19 por día, que es 6% menos de lo que pasaba la semana pasada. Así que todavía podemos seguir trabajando con las vacunaciones para seguir bajando los números de casos por día, pero nos encontramos en una situación mucho más favorable de lo que nos encontrábamos la semana pasada y las anteriores con este repunte. La positividad está a 2.3%, lo más bajo que se ha registrado en agosto. Hay 14 hospitalizaciones al día, que es casi, se ha bajado el doble de lo que teníamos las semanas pasadas, lo que también es una disminución significativa y motivo de celebración y otra vez para seguirnos vacunando. Es incentivo para seguir este proceso de vacunación, lo que significa que efectivamente estamos saliendo de este repunte. Actualmente estamos administrando 5.714 vacunas al día y realizando hasta 20,000 pruebas de COVID-19 diarias. Todos estos datos se pueden encontrar en nuestra página web chi.gov/covidvax. La semana pasada el Departamento de Instrucción Pública o CPS anunció una serie de nuevas medidas para fortalecer la prevención y mitigación del COVID-19, incluyendo el lanzamiento de un tablero reestructurado de actualizaciones de COVID-19 en la página web dedicada para el acceso integral a los recursos vitales del COVID-19 en el CPS. Y lo pueden encontrar en el cps.edu/COVID-19. Estas nuevas medidas incluyen duplicar el número de rastreadores de contacto. Se implementó el programa opcional de pruebas de detección de COVID-19 en todas las escuelas del CPS para los padres que estén interesados, por favor, para seguir nuestro cernimiento. Esto se suma a otros pasos importantes que el CPS ha tomado y que han estado vigentes desde el comienzo del año escolar, que es mandato de máscaras para todos los edificios escolares o entornos cerrados, mandato de vacuna para los adultos y estudiantes elegibles que estén en equipos de deporte, e invertir en mejoras críticas en la infraestructura del sistema de ventilación en las escuelas. Una de las razones por la que hemos abogado tanto por la educación en persona es porque los datos muestran que las escuelas pueden y deben estar abiertas de manera segura. Incluso antes de que las vacunas salieran, los datos ya estaban ahí, con mitigaciones multiestratégicas de varios niveles. Creemos firmemente que no se trata de solo un estudio académico, sino también del desarrollo y el beneficio del aprendizaje social y emocional de nuestros niños. La vacunación contra el COVID-19 en vacuna sigue siendo el arma más poderosa y debe incluir estudiantes elegibles. Sigue siendo la protección más poderosa en las comunidades escolares para mantenerlas seguras y saludables durante este año escolar. El CPS sigue trabajando con el Departamento de Salud Pública para hacer todo lo posible para alentar a los estudiantes y sus familias a vacunarse. En octubre 4, los informes de la página web del CPS en COVID-19 confirmaron 307 casos de COVID-19 en empleados y 1.166 en estudiantes, total desde el comienzo del año escolar. Estos números son números relativamente bajos cuando se mira a una población total de aproximadamente 380,000 miembros del personal y el estudiantado del CPS. Es aproximadamente 5 niños en cada 1,000 que han contraído COVID-19. Las pruebas del COVID-19 se han duplicado en niños de Chicago desde que el CPS reabrió. Sin embargo, la tasa de casos diarios promedio de todos los habitantes de Chicago, de 0 a 17, se ha mantenido baja y alineados con las tendencias de la comunidad. Si protegemos y nos vacunamos, protegemos a nuestras comunidades y por ende también nuestros jardines escolares. Reconocemos que los padres están preocupados y el CPS y el Departamento de Salud Pública están trabajando de cerca para asegurar que identificamos y respondemos rápidamente a cualquier caso de COVID confirmado o sospechas que ocurran en las aulas. Los líderes escolares están siendo extremadamente cautelosos y a veces implementan cuarentenas estudiantiles limitadas como una estrategia preventiva al investigar casos y contactos potenciales. Los salones de clase siguen siendo el lugar más seguro para niños. El contagio en las comunidades es más alto. Siempre ténganlo presente y el arma más poderosa es la vacunación en familia. Y ahora con otras actualizaciones tenemos vienen los refuerzos. El 14 de octubre ya someten a la FDA de parte de Moderna, donde se recomienda la mitad de la dosis de las series principales de vacunación. Y el 15 de octubre Johnson & Johnson somete a la FDA también para revisión para refuerzos. Recuerden, la ciudad sigue recomendando que no mezclen productos farmacéuticos. Si empezaron una secuencia de vacunación, manténganse en esa secuencia de vacunación. Es la manera más segura. Y por ende, también tenemos las vacunas o terceras dosis para aquellas personas que tengan inmunosupresión moderada, severa, ya están elegibles. Y tenemos toda esa información en el chi.gov/inclinada covidvax. Y ahora los dejo sin más con la doctora Arwady y el CEO Martinez.
Gracias. We'll take questions, folks, if we can kind of move from left to right here. And please limit it to one and a follow-up if you can. And if you can identify yourself too, that would be great.
Great. Raúl Delgado with Telemundo. Dr. Arwady, are there any travel updates as of today?
Sure. I shared this morning on Facebook that Connecticut is the one state that has managed to make it off of the travel advisory. So at this point, unfortunately, across the whole U.S., Chicago still has a COVID rate less than half the average rate in the U.S. And California, Connecticut, and Puerto Rico are the only states and territories that are not currently on that list. As a reminder, we recommend that people who are unvaccinated not travel to the other states besides those, and if they do travel, they should quarantine upon return with additional testing guidance.
Great. And is there any concern with the number of students that are quarantined compared to the number of actual confirmed cases?
Yeah, so let me put a little more detail on that. So one of the reasons, we've been following this all along. We shared last week that it was in the 98 to 99% of the kids who are being quarantined were not going on to develop COVID. We've seen that continue where we had the opportunity to have, a full month, almost 5 weeks of data around that. And that is part of the reason why we've recommended that to CPS and all other schools in Chicago that have not already done this, that if they would like to, it is the decision of the school district, to be clear about that, they can shorten the quarantine from 14 days to 10 days. One other thing I'll note on that, we've really seen that this kinds of decision depends on how things are going locally. So we are in very good shape here from a COVID perspective right now here in Chicago. When things are going well in the community, when you're not seeing major problems with spread in schools, that is when CDC, IDPH, CDPH recommend being able to shorten that quarantine. We've seen with Delta, which is now virtually all the cases, more than 99% of the cases are this Delta variant, it comes much faster. So we tend to see people more quickly get infected, and it's much less common to see somebody, in that much later stage of quarantine, whether in school or out of school, do it. So, for example, and that would, we would make that recommendation if there are workplaces, for example, that want to do this as well. City of Chicago workplaces are already using a 10-day quarantine, and it is appropriate to do that at this time for Chicago Public Schools or other schools in Chicago that want to. We'll obviously continue to monitor the data and if we see anything concerning. But that's one of the things we're looking at, really wanting to make sure, of course, we're using quarantine to keep kids safe, but if we don't need to use that quarantine as long or as often, we know it's disruptive for students, we know it's disruptive for families. Our goal is to keep kids safe in school and continue to look at that data.
Hi, Nader Issa with the Sun-Times. Dr. Arwady, when the testing program was first rolled out and established in August, the message to CPS families from the district was, we're committed to testing 100% of students every week. That's the message that was put out and sort of repeated in emails and all the messaging to families. But you're saying now that that's not necessarily the case, that students, if they sign up, would be tested every week. I'm trying to figure out what has changed, and then
happy to put some more context around that.
Sure.
And I know one of the reasons we're really wanting to come up here every week is to make sure we're really being clear about this, because I know it's something that people have had a lot of questions around. I am quite sure that I never, personally said that we would be testing all students every week, because there are different kinds of testing that's available, and really our goal is to get to a point where we have this surveillance testing. And let me just explain, or screening testing in place. And if you look at the CDC website, for example, or you look at some of the guidance here, what they basically say is that there's not a stated goal to be doing everybody every week necessarily, right? That's if you have that, lovely. But in terms of not missing cases, really what they recommend is trying to get to a point where 10% of the unvaccinated people in a school setting are being tested in a given week. Because if you're testing 10% of the unvaccinated in a school setting, that's considered, particularly when you're in reasonably good control like we are right now, that's considered appropriate from an assessment. Again, our goal is to make sure we're not missing cases. So you heard me hint that one of the things that we'll be looking at here is I want to really make sure, and I know CPS does as well, that where that testing is happening, it's where it is the most needed. So that we're especially focusing on unvaccinated areas. We're potentially focusing some more on some of the schools where we don't see as high of childhood vaccination rates. And of course, we want to make sure that there is the opportunity to, where there are clusters or outbreaks or situations, we want to make sure Chapter, there's a lot of testing resources available there. So as soon as there's a situation that you're investigating, that is different from a public health standpoint than the standard screening testing. There are recommendations, for example, if there are higher risk activities like some of the sports or some of the extracurriculars that you would want to be aiming toward more frequent testing. But from my standpoint, that's really what we're aiming for. And there are some schools that have had many more parents than 10% turn in permission slips, and there are some that have perhaps not even had 10% turn in permission slips. I don't know the details of that, but that's some of what we'll be looking at. At no point did we ever have a plan to test students without parental permission. And so that's part of the, at no point saying, 100% would be in place there. But the goal is to keep improving the capacity there and keep building that. I'm very pleased with the improvements that we've seen. And we'll be working with CPS closely, as we have been, to be really making the processes that are being used as efficient as possible. That's where you see some of this improvement in the times of contact tracing, et cetera. Really excellent progress. And we're going to keep working together to keep making progress. And any place where we're seeing, signs of concern in a school, we will absolutely be in there with very widespread testing availability, just as we have been.
And then a follow-up on related to staffing. Mr. Martinez, you talked about needing to ramp up staffing. Obviously, this was before your time, so I'm not sure if Dr. Arwady can answer this too, but why wasn't staffing established in the summer, before the school year, before you actually needed to go ahead and conduct this testing? And along with that issue on staffing, Dr. Arwady, last week you said parents, and today, shouldn't necessarily expect a phone call if their child is quarantined, and that's not part of the contact tracing process. What exactly do contact tracers then do? From contact tracing to case investigation, what's the difference and what do they actually do?
Yeah, so, and I'll ask Dr. Arwady to help me on the contact tracing question. As I shared with you last week, everybody, the goal here is just to share with you and be very transparent about what's happening. I'm not going to go and second guess what didn't happen or what could have happened earlier. Like I said before, it is now my problem. What is very clear to me, though, is that, and it's the questions that I'm asking, knowing where we're at today, and you just heard Dr. Arwady said, really, the science says if we can get at least 10% of our unvaccinated, either students or staff, we have the highest probability of catching unidentified cases. That's what the science says. Is it great to have higher percentage of testing? Absolutely. Again, I had that in my former district. It reduced the anxiety of the parents. And so that's the reason why, I am looking at this so closely to see how quickly can we ramp up. It does beg the question for me, and I just want to put it out there to say, in order for us to be equitable and really looking at situations where there's more risk, right? Because maybe that area, that community has a lower percent of individuals being vaccinated. I know in particular schools, I have higher anxiety than others. I know that already. I can see that now just on day 5 on the job. And so for me, one of the things that I am asking, and this is always going to be in consultation with Dr. Arwady, she's an amazing asset for me and the Department of Health, is, again, as we look at what's the realistic timeline for ramping up, what is the best way to strategically use the capacity we have for COVID testing today? And that is a question that I am putting on the table. Again, on day 5, I'm going to do more research before we make any final decisions. But just so you know, those are the pieces of the puzzle that I'm putting together right now. And so for me, the number one thing the message that I want parents to hear, though, in terms of actual COVID cases, and now the contact tracing has become much more timely, we're not seeing any evidence or very little evidence of high risk in the schools. We're just not seeing it. And so again, we're going to continue, though, to look at how do we better perfect our safety procedures. That's a commitment I'm always going to have. But again, I want to make sure we always lead with the facts and always lead with the science. And the commitment that I'll make to all of you is that I'm always going to be direct and straight with you about what we're seeing. And again, there's no point to go back and second guess the past. There isn't, because our children are in school. What our parents want to know is my child safe? And this is what I'm getting louder and louder. CEO, my child's been in quarantine. What do I have to do to get my child back in school? And I even get emails. I'm getting my child tested. It's negative. And so again, part of the problem right now is because we're playing catch up. I want to be more proactive, because I'm seeing other districts around the country that are already being more proactive. And so again, I want to shift to that. That's the goal. But again, right now, I just want to share with you exactly where we're at today. Dr. Arwady?
Yep. Thanks. So little bit of detail around case investigation and contact tracing. So the first priority always is to do the case investigation. The case investigation definitely includes talking to the case, the staff member, the student, family, et cetera. And then from that, you're determining, what exposures there might have been. The reason that not just in CPS, but in school districts, across Chicago, there is a separate contact tracing effort within the school is because that school knows best how students are moving through that school. That they know best, if the 2 5th grades had to for some unexpected reason had to have lunch together at a time they wouldn't have, or there was something going on where people had to remove masks, or there's the ability to do that investigation at the school level. I want to also highlight a little bit of sort of the role of the health department versus the schools. As the health department, we have the responsibility for protecting the health of all Chicagoans. That, of course, includes students, and we've had a big youth focus at CDPH from the beginning. Our primary focus in terms of the day-to-day, both testing accessibility and case investigation, contact tracing, really remains all of the community settings outside of schools, for example. And so over the summer, we did work to make sure that there was a lot of funding available to all of the different school districts. And then different school districts were able to make their own decisions about which vendors they used, the details, that are in place around what their testing protocols, would look like. We, of course, have been consulting on that. And I think when CPS came back in particular, just again, CPS is the size of a not very small city. And I think the numbers of both students and staff that were back, I think the team had just not planned for quite the volume that was in place. And so we've been working much more closely these last few weeks with CPS. And again, I'm very pleased with the progress. The screening testing is not the most important thing in terms of preventing COVID in schools. It helps us make sure we are not missing unexpected COVID outbreaks, but all of the mitigation procedures that were in place long before we had testing available in schools, and especially long before we had vaccines in schools, we know are working. And so the reason I show a number of these different data sources is because those are what we track, and we look at them across school districts to see, are we seeing concerns? And anywhere where we're seeing a concern, we would come in and, if there needed to be a school shutdown, for example, we would be doing that in conjunction with the school.
Hi, this is Brona from WGN. I just wanted to clarify some of the numbers. You'd mentioned something about 500 schools have been visited so far, or 500 schools are being visited per week?
Yeah, so we ramped up the number of schools that are getting access to COVID testing to 500. The challenge, though, is that as I'm seeing more and more consent forms being signed, again, the real question right now is how quickly can we ramp up as as we're getting more and more individuals wanting to get tested. And so that's the challenge. Now, again, I'm heartened by the fact that we went from just under 8,000 tests to 15,000 tests, and I can tell you even today, and we're tracking this daily, just yesterday we had close to 4,000 tests. So the run rate is growing every year. So if you put it for the week, that we could be easily at close to 20,000 tests by the end of this week. But with that, there's two variables. We have more families and staff that are consenting to get tested, so that number is going to keep growing. And so the question that that we're going to get answered this week is, what is the realistic timeline of that ramp up? And the main variable I can share with you is the challenge of our partner to be able to get to staff up. That is a challenge. And by the way, it is a challenge. We have a tight labor market that I see that across even our schools as well, across many roles, as you know as well.
So are there potentially some schools in the district that screening has not been done at?
So I can tell you that last week there were approximately just under 12 schools that did not have any testing going on.
Since the beginning of the year.
Right. So remember, we've been ramping up schools every week, and so we were almost at every school with the exception of 12 schools.
Okay.
And I'm still getting details about, what the challenge was there.
I also wanted to just clarify something. You mentioned one of the slides said like 8,400 and something tests have been administered so far to students and staff, but then you mentioned 11,000 and 15,000, and you just mentioned 20,000.
No. So so on our website, you see a ramp up from 6,100 to 11,005 total tests. That's both staff and students. The way we show the data on the website is it's tests where we have actually gotten results. So there's always a 24-hour lag at a minimum when we get results. When I factor in all the tests, including the ones we didn't get results through Friday, we were over 15,000. And so right now, like I said, as of Monday, we were close to 4,000 just for yesterday alone, just tests in general. So again, just doing the math in my head, we're at a run rate this week close to we could get to 20,000. The challenge I'm calling out is what we have right now, as of today, 35,000 consents. And so it really is, if that gap is really what I'm now looking at, how can we close that gap knowing that 35,000 is going to grow? Again, we're ramping up. It's clear in the number of tests we're having every day. So that's really now, right now the information we're gathering.
So what is the actual number for tests that have been administered since the beginning of the year for which you have results?
Let me get you that exact total, because right now, like I said, I'm looking more at ramp up, just really true ramp up, because to really answer the question, is everybody who has given consent, can they get tested, and how quickly can they get tested?
And it is available on the website, broken down by week,
Yeah.
staff, students, the whole thing.
Perfect. Okay, thank you.
I have two questions. I'm Sarah with WBEZ. One is, do you guys know where you are on how many staff are vaccinated? I know the deadline to be vaccinated is coming up next week, and if there's any areas that you're concerned about.
That's a good question. So we're monitoring that on a daily basis as well. So of actual submissions of vaccination cards, well over 80% are now we've had the cards. One of the challenges that we are seeing, though, is some of our staff have reported issues just on the technology side of getting their vaccination cards in. So right now, and it grows every day. So every day we're getting at least 1,000 submissions of the vaccination cards. So we're going to be monitoring every day. And so, of course, what we have said to our staff is that as long as there's a good faith effort, so in other words, there's at least a first shot by October 15th, we will actually look at that as saying, okay, there's a good faith effort. That means they're on a path to vaccination. So right now, I'm actually starting to look at those. What is the risk, and in what area? So I'm starting to look at that now. It's a little early because, again, we're seeing a very healthy submission of vaccination cards every single day. But as we get close to the 15th, we'll get that number. I can also share with you we have about approximately 1,000 exemption requests that we're going to be granting for religious and medical reasons as well. That's also part of the other numbers.
Does that also include like private vendors? Are you guys tracking that, and how much? Because you guys said that you wanted everybody to be vaccinated, including private, like people who work in schools for private vendors. So
the numbers I just shared with you are more our staff, and we can definitely get you what's happening with the vendors. Although all of our vendors, again, have also agreed to meet that mandate as well. But I don't have those details right now. But what I am tracking very closely is staff.
Okay, and then one other question I had for Dr. Arwady is that you mentioned linked cases, and I know before you have said that there was no in-school transmission. So what's the difference between linked cases and in-school transmission?
Yeah, so every time that we're investigating more than one case in a school, and we do this together with CPS or other schools, our question is there potentially in-school transmission, right? It's unusual to 100% know that, but we make a determination. If there is a more likely out-of-school transmission route, like siblings, or like we know that two people were at something that was a much larger outbreak outside of school, we make a determination that it is more likely that that was outside of school. So the 17 clusters that I referenced are these 17 examples where we think there has been at least one sort of in-school transmission, meaning two cases that have been linked within school. We have not seen at this point anything, as of last night, anything that was larger than 4, but we have seen a couple of examples like I showed where you have 4 staff or 4 students, and that again does include extracurricular activities, break rooms, times where people are taking off their masks, things like that. And so whenever we are seeing an example, 17 is a very low number, to be clear, across all of the schools. schools for the, the 5 weeks that we've been in session, and it's not at all out of line with what we're seeing in non-CPS schools. But whenever we see that, we're doing an extra look with CPS at what happened here, right? Was there a break in protocol in some way? Is there anything that needs to be addressed? Is there anything that we can do to limit it? We're never going to completely eliminate the risk of COVID in schools, but in terms of, I think I get a lot of emails, so I think people are imagining there are like very, very large outbreaks and like hundreds of children being infected with COVID. We are absolutely not seeing that.
And were any of those cases Jensen of the linked transmission?
So again, Jensen continues to be ongoing. I can tell you, and I think I'm going to follow up details with my team. I can tell you that we're aware of one linked transmission there, but not associated with the cases that were making news.
Any other questions?
Hi, it's Cassie Burke from Chalkbeat. I have a question for CEO Martinez. So parents, when you talk to parents, one consistent thread is that the information about opting into testing is buried at the bottom of the school newsletter. They don't see it. It's kind of underneath curriculum night. Is the district sending any messaging to schools to try to make that more present? Is there any effort to translate that into different languages? Could you talk a little bit about that opt-in rate and boosting it?
Yeah, no, absolutely. So that has been the goal, and actually we have been now meeting with principals and just understanding the barriers for people providing consent. So for example, one of the things that I heard very quickly was the form is very complicated. So we're exploring, is there a way for us to simplify the form? It is, I'll tell you, I saw the form myself, it is intimidating, especially for our parents who English is a second language. So that is something that we're looking at. But I will say, the bigger question now for me, now that I have all the information I have today, is also making sure that we can be realistic on expectations for both our families and staff around COVID testing. It's a great resource, but I also am concerned right now that in us trying to catch up, really to close this gap, which the gap will only grow wider, right? The more successful we are in getting families consented, I feel that one of the things we're losing is the ability to use this resource in a much more strategic way, because with so many schools, I can tell you right now, even just on day 5 on the job, I see different anxiety levels. There's some schools that we know that it would be, I would prefer, especially if the parents consented, to be able to provide COVID testing to all the students just to reduce the anxiety. Other schools, they're fine. They really are good where they're at. And it's because of all the data Dr. Arwady has said, the cases are just low. We're not seeing evidence that, and I'll tell you, I've been to schools almost every day now since I started. I see the safety protocols myself. And like I said, I know what to look for. I was battling with this in my former district, had the luxury of the planning time to be able to get the things that we're trying to get in place well before the school year started. And so as I'm seeing all the other safety procedures, I feel very confident when I see the interactions of our teachers, our students being masked. I see those safety procedures, but I also know as a parent, there's anxiety. And I shared with you last week, I am not going to ignore the anxiety. So any way I can find to reduce the anxiety, I need to do that, which is why right now I'm looking at our COVID testing data so deeply, just so that, again, just basically asking the questions. How quickly can we ramp up? How realistic is it? And is there a more strategic way of using this, COVID testing? Because there's examples across the country of how districts are actually don't have COVID testing in every school, every week, but they're using COVID testing as a strategic way to minimize quarantine and, frankly, do what I want to do, which is reduce anxiety.
I'll just add one thing to that. Having more consents back from parents gives us a larger pool to do that random testing in, right? And so even if we're at a point where you're doing 10%, which again is something CDC advises that we aim for, where we talk to other districts, having a large number of people in that pool lets you choose a 10% that's different each week, and that would also be a goal. So everybody who is interested in having their child tested should do that consent form.
Thank you.
Yep.
For the CEO, please. I'm Aaron Gettinger with the Hyde Park Herald. You said at one point that the only way through the pandemic is through vaccinations. I'm just wondering what your opinion and what you're thinking about in terms of vaccination mandates for CPS students is at some point, obviously with Los Angeles and some other school districts either putting them in place or moving towards that.
I've never hidden the fact that, and I push this, in fact, I talked to Secretary Carmona directly about this. I really do believe that there should be more bold action at the federal level because they have more data than we do, and they have it sooner than we do. I think vaccine mandates should be on the table, but that should always be led by health professionals, not necessarily by the superintendents or CEOs. One of the things that I also recognize, because as I'm going to schools, part of just gathering more information, I am asking the questions. I'm interacting with students and asking the questions. Is there hesitation in your family to get vaccines? And I'll tell you, it's interesting because you can see by the slides that Dr. Arwady sent, in certain zip codes, there's a lot of hesitation. And so for me, what that tells me is that we just have to be, and we're going to partner with Dr. Arwady on this, we just need to continue to provide information to the families so that, one, making sure that they know it's accessible, two, that we answer their questions. Because we have to recognize the fact that there is hesitation. So even if you put a mandate, it's one thing to put a mandate over employees. We have more control over our employees. We even have more control over our vendors. I'll tell you, ladies and gentlemen, it's a different story to do that for families. And I think for me, I just want to make sure that we, being just day 5 on the job, I just want to make sure that we're providing all the information we can to the families to reduce their fear of maybe some of the things they're worried about with the vaccine. Because frankly, there's a lot of questions, that some of our families still have.
Why logistically it's different for families than it is for vendors or staff or anything like that?
Because for our employees, again, first of all, we have more authority, right? We actually have a stronger legal standing to stand on, number one. Number two, we have enough evidence that having our staff vaccinated is one of the key safety precautions to reduce spread in our schools, right? I mean, that's something that we know just from the data from just what we've been through with COVID. I also know with families and our employees, we have the ability to give them information in a much more timely way. So again, to be fair to our families and our communities, being, again, folks, day 5 on the job, I just want to make sure that we're answering their concerns and their questions. Because frankly, there's, let's face it, whether I like it or not, there's a lot of misinformation about vaccines that has been out in the community. And true or not, if we don't counter that misinformation, again, our families are going to be hesitant. And so again, that's something that I just feel we as a partner to our families, we owe that to just make sure they have that information. I think what's going to be interesting once 5 to 11-year-olds get approved, seeing what how quickly we can do that and what information the families will need for us to be able to, really execute on getting 5 to 11-year-olds vaccinated.
Thanks. And a follow-up for Dr. Arwady, please. Forgive me if you've spoken to this publicly already, but I'm not sure if you've responded to the watering down of the mandate requirement for some city workers, particularly people like the police, to get vaccinated for COVID-19. Instead, there's a testing requirement being put in place by the administration instead. I mean, there's some city workers that are public-facing employees, and instead of being mandated for tests or for vaccination, they're having a testing requirement instead. Do you have a professional opinion about this change of policy?
Yeah, so what I can say is that just like at CPS, October 15th is this deadline for city employees to be vaccinated. I know I am not directly involved with them, but I know there are continued ongoing discussions with the various unions about some of the details of, for example, if there were to be testing options, how long those might last, what that might look like. There's a lot that is still being worked out there. But what I want city employees, any city employee, to hear is that October 15 is your deadline. Please be turning in those cards, because just like CPS, what we're seeing is every day more and more city workers getting their records uploaded. And you can do that easily on your phone. You can do that easily on your computer. It takes about 2 minutes. And so we've been working at CDPH, for example, where I know almost everybody is vaccinated, to ensure that all of those records are really getting in, and that if anybody is planning to apply for an accommodation, that they do that soon. And I really can't speak to any more details of the negotiations, that are continuing around that sort of post-October 15 date. But really, for everybody, please, The reason we're doing this is to try to have a safe workplace for you, and then as people who are serving the city of Chicago, not inadvertently increase the potential for spreading COVID to Chicagoans.
Great, thanks everybody.